Am I audible, guys? Do let me know in the chat box, please. Am I audible?
Yes, Atif, you are.
Sure. So, a very pleasant good evening to the participants. I welcome you all to the CliMed PharmaEd Career Cafe, episode 7, a way to make good clinical pharmacological career, having a chit chat with Dr. Grace. This time, we are privileged to host the fantastic Dr. Grace, ma'am, who holds almost 9 years of experience in academics as an assistant professor in the field of clinical pharmacology and as well as clinical pharmacy. Dr. Grace is first in India to receive board certification in pharmacy specialties in infectious disease, BCIDP, and leading to the top notch of LinkedIn with more than 8,000 followers. Is a part of curriculum in PharmD. Ma'am is also monitoring and guiding more than 100 plus students of PharmD. Ma'am got her training in the Department of Infectious Disease in Antimicrobial Stewardship at CMC Vellore and also at Tufts Medical Center, Boston, US, Detroit Medical Center, Michigan. Ma'am served as International Ambassador at SHIA, Society of Healthcare Epidemiology of America. Currently, Ma'am is serving as BPS Ambassador, Board of Pharmacy Specialists. Ma'am has been involved in many national and international conferences as well as seminars. Ma'am attended faculty developed programs and workshops as well as earned many certifications and also serves as the active peer review for international journals. Ma'am has exciting academic journey as she completed her PharmD from PSG Institute of Medical Science and Research Center, Coimbatore. So with this amazing and inspiring introduction, we welcome you, ma'am.
Hello, good evening, everyone. Thank you so much, CliMed, for having me here for your cafe series, for letting me share my story of how my PharmD career has been. So it's a privilege for me to be here. Thank you so much.
We welcome you, ma'am, once again. So, ma'am, I am very glad to know that you are here. Such a great personality I am hosting right now.
Really?
Yes, ma'am. You're the first in India to be there at the international level, ma'am.
Thank you. It has been a privilege for me, and I'm very happy that it happened in 2021. Hello, am I audible? I'm sorry, I thought I got. Yeah, all right. So, like I was saying, it's like a privilege for me to be here, and this I was saying that the board certification has been, in a way, it kind of exploded for me for my career, and the way it has changed my career. It's amazing the journey that I have been a part of. It's truly wonderful. And in 2021 is when I received my board certification, and I believe that was the first year when anybody tried board certification from India, and it like I said, it changed the course of my career. Kind of put me on the map with specifically for the PharmD students. I think I was able to give hope to a lot of students to take this exam, especially for those who are working here. Those who want to work in a clinical setup, in the Indian setup, that you can be a specialized person and you can work very well. You can earn your respect. You can earn your degree. You can earn everything. So it's been great for me, and I always love to share my journey if it inspires anyone at all. So like I said, thank you for having me. Thank you.
Definitely, ma'am. If you love to share, and we will love to hear also, ma'am.
Yeah. So Do I just start saying how it started, or do you have specific
Ma'am,
questions for me?
ma'am, we are having some specific questions, ma'am. We will
Yeah,
go with that.
yeah, sure, sure.
Sure, ma'am.
I'll wait for your
Sure, ma'am.
questions. Yeah.
So, ma'am, you hold a good experience in academic as an assistant professor. What are your subjects of expertise, and what subject do you think a pharmacy student need to look up in their academics?
All right. With if you ask me with regard to like the college, at the college time when I was doing my PharmD, what happened, and right now where I am currently at. So
Yeah.
definitely, like you would all agree that pharmacotherapy is going to be our subject. So we are all going to be a pharmacotherapy specialist kind of thing. So without drugs, we won't be able to, do justice to our PharmD, the course, the degree that we are holding. So definitely, if you ask me which subject we need to stress upon is pharmacotherapy. And like the stress that they have given pharmacotherapy, because for our 6 year career, I mean a 6 year course, you know that pharmacotherapy 1, 2, 3 we have, whereas pharmacology it's 1 and 2, and the second year, third year.
Yes, ma'am.
Pharmacotherapy is second year, third year, and fourth year we have. So in a way, it is good that they have given us, instead of putting everything together in 1 year, that they have spaced it in our curriculum to go through the pharmacotherapy, the books, the Dipiro, the Codacumul, and all these books. So these are the base. I mean, I would say as a clinical pharmacist, when it comes to your practice, this would be your base. But like in your college, see the problem with us students. I mean, when let me go back to my time when I was a student. So the problem with me when I was a student was that, especially I belong to the second batch of PharmD education in India, the regular PharmD education, that is 2009. So my college had the seniors, the first batch of PharmD, and they had no clue what to do. We had no clue what to do, and our teachers also, they didn't have much clue as to what to do, because everything was like they've been given certain things, from teaching B Farm, M Farm, pharmacy practice. They just shifted their gears and came to teach us the PharmD. Uh, but as a student, the problem that you have, I mean, what I had was with regard to the guidance as to why you need to learn certain things, why and where you need to focus your skills, and where do you, how do you gain your skills, your clinical skills, being a clinical pharmacist. These were the things that I lacked during my studentship. And I I don't know. I like chemistry a lot. So the first year, because we have so many chemistries, we have organic chemistry, inorganic chemistry, all these things were there. And luckily for me, because chemistry was was one of my favorite subjects, chemistry and biology. I took interest in learning, in the sense like I was good at my studies for my first year, and I remember for the first sessional and even for the first year university exam, I came first in my college. But what happened is that, see, the thing is, you learn for your examination and then you forget. Is what usually happens being a student. So, like now that I've taken infectious diseases as my specialty, I know that the core of infectious diseases is going to be based on your microbiology. All right. So, without knowing microbiology, there's no infectious diseases. You have to know your microbes before you start treating them. So, what are the gram negative? What are the gram positive? What are your fermenters, non fermenters? But if I look back at my time in the college, what did I learn during my studentship for second year microbiology? The only thing that I can recollect is sterilization. The sterilization techniques, the gram stain. That was the only thing that I can remember. But that is where our teachers should tell us that, see, this is not for the sake of examination that you're studying. This is for your career. If you want to know about your antibiotics, you have to know about your bugs, and therefore the focus has to be on the bugs, on all these E. coli, Klebsiella, and all these things that are clinically relevant to you. So such things are not being conveyed in our colleges. So I hope slowly the curriculum will adapt it, because more and more clinical pharmacists are getting placed. They get to know that, okay, these things are important. So maybe at one point we'll be able to drive the curriculum in such a way that there is vertical integration of our subjects. Not just learning it for the exam, but whatever we are learning, we are able to develop some skills out of it, so that it will be useful for our clinical experience as well. So, like I said, microbiology for an infectious diseases person, microbiology without micro, there's, I mean, you can't. And similarly for all the diseases. So, I we have a lot of interns coming at the Believers Church Medical College Hospital, which is a place, the amazing place I've been working for the past 8.5 years. So, I have a lot of interns coming here. So, one thing that I tell them, is that when you are taking a case, when you are in a hurry to find interventions regarding the case, find something to present in front of your teacher, so that you somehow you stand out as, oh, they have done something for this patient. But we all know that it's a farce. We are just doing it just to please them, without actually doing the things that we are telling in the presentation. We all know that. So I don't think I have to be very diplomatic in saying that. I can be very explicit in saying all these things, um, because this is what I've gone through and how I have suffered because of all these things that I've done also. So when it comes to a case, whenever you're let's say your first posting or the first case that you're having at hand is going to be, let's say it's a myocardial infarction, a patient who came with a heart chest pain, and found out to have either a non-STEMI or a like NSTEMI or a STEMI, whatever it is. The patient is admitted. You are the you are the clinical pharmacy intern who's going to work up that case. So what I tell them, my interns, is that the first day when you are studying about, so basically the task you have at hand is to study about myocardial infarction. Okay. So, and how to present a case on myocardial infarction. So in that case, the first thing that you have to do is that go back to your anatomy, go back to your physiology, go back to your first year and see what the heart does and what is the physiology behind it. How the heart pumps, which are the muscles, which are your arteries, all these things. You just have, it will only take like 15 minutes maximum. If you see one of the YouTube videos, you have so many, like osmosis or something, just to brush up what you've learned in the first year, just the anatomy and the physiology, all the valves and everything. And then the next step for you is to understand the pathophysiology. So what happens when there is a problem, when the physiology is no longer normal, when you have a disease, what happens during that disease? Because basically we are all trying to correct that problem. So for you to understand that problem is very important. So pathophysiology comes why is it in echo that we see hypokinetic, this left ventricle is hypokinetic or LA is hypokinetic? You hear all these things. Why is it so? So what happens in a mind? So if you have a basic understanding of that, it helps you, understand what you're treating in a much better way. And once you know your pathophysiology, then you go into the pharmacology of it. Like, what are the drugs that you would choose? Not choose. I would say, what are the drugs that act on the cardiac system? Okay, because you have so many things that you have for cardiac system. So, what are the general? I'm not saying go in depth into all these things. At least just brush it through so that these are the agents that are available. So once you know, okay, so that till this time you've known, okay, these are the drugs, the ACE inhibitors, the beta blockers, the anti-anginals, the vasodilators, all these things you have. So then you have to go into the guidelines. So that's where you have to spend your time, and that's when you go to the because I've recently visited one college, in Kerala, and they don't know how to dig up the best guideline. So the easiest way that I found out is that whichever disease you want to know, because you don't know which is the standard guideline that you are following. So instead of writing standard guideline, STG, some standard treatment guidelines, what in practice in hospitals that we follow for cardiac specifically, it is American Heart Association or the American College of Cardiology guidelines. So if you I can understand that we might not be hearing about all these words during our study time. I mean, during our, in pharmacotherapy, definitely it is there, but we might not know it. So the easiest way for you to browse it on net is that whichever disease followed by clinical practice guidelines. So if you put clinical practice guidelines, it will come up on top like AHA or European Society of Cardiology. All these things will come, and then you can just browse through the guidelines. The problem that we are having with our education is that we are not taught the guidelines. We are not getting to learn the guidelines. So unless you know, like for secondary prevention of an MI, you will send the patient on a dual antiplatelet agent. You will send the patient on a high dose statin. You will send the patient on a beta blocker. You will send the patient on an AC inhibitor or an ARB inhibitor, unless these are contraindicated. How will you make an intervention? Let's say the doctor forgot to ask a beta blocker. So if you know the guidelines, then you can intervene saying that, is there any reason why you skip the beta blocker? Is there a bradycardia or something that you have that is worrying you for adding the beta blocker for this patient? Or for an ARB, for instance, is the patient having hyperkalemia or some kidney related problems that you're in, like an AKI, for which you're not giving the patient an ARB. So if you know the guidelines, then it's easy for you to intervene. It's easy for you to see what is deviating from the standard practice. That's how you make a clinical. All these things has to come in during your internship, and unless you do that, we will try fixing the cases in the way we like, just for the case, sake of presentation to the doctor. I mean, to our mentors or to our preceptors. And one last thing that I would ask everyone in the audience who are listening to me is that, do you have the guts to present the same case to the doctor who has prescribed, or the treating team whose case you are taking? If you have the guts to do it, then you're doing it right, because we botch up a lot of things. So if you are saying, oh, these two things are interacting, so this should not be given together, we changed it and all that. So unless you are able to tell that to the doctor and make those changes, I don't think it's a relevant clinical intervention from a clinical pharmacist perspective. So knowing the guidelines is the first way, something that every intern has to start looking up whenever you're presenting a case. It's an exercise where you study. It's an exercise where you learn the skills. So this is how you learn the skills. Go and see the clinical practice guidelines of whichever disease the patient is acutely admitted for, the hospital care the patient is receiving. What are the guidelines saying? How do we correct it? That will give you an overall approach into, a good, for being a good clinical pharmacist.
Definitely, ma'am. I hope the audience will follow your words, ma'am. They will mark your words, I think so. So, ma'am, moving on to the next, you have an impressive array of certifications, ma'am. How do these certification enhance your academic practices? And what kind of certification or courses do you advise a student to go for? What are the trusts, able, and platform for these certification and courses, ma'am?
Okay. I'm just thinking the certifications that I'm having. So I think you are talking about, you're not talking about my experiences in the US, right? You're talking about the courses that I've taken. Or,
Yes, ma'am. Yes, ma'am.
or do you want me to touch upon the US experience? No, not now.
Ma'am, it will be very good that if you will share the USM.
All right. Okay. All right. So, no, I was just asking, is there a separate question on that, or it's there?
No, ma'am. No, ma'am. No, ma'am.
Okay. All right. So, um, see, when I first started my journey as a clinical pharmacist, this hospital that I'm working, Believers Hospital, I was a first clinical pharmacist to be appointed in this hospital, and it was a new hospital at that time when I applied. It was only 1 year since the hospital started functioning, so I was new to the whole thing. Everybody was new there because I didn't have that big problem of doctors who've been there for so many years in the hospital. Oh, who are you to come and do this, that? I did not have that great problem that everybody is facing. I'm very thankful for that. And but the problem what I had was that nobody had heard about PharmD. So after my graduation, I wanted to work somewhere nearby my house. So it's only 40 minutes from this hospital. So that's why I initially applied to Believers. I remember after graduating, I had I graduated from Coimbatore PhD. So while I was coming off from PhD, I had my CV printed, 10 sets of CV printed with me so that I can apply for jobs all across. Wherever you get in, you get in. So that was the plan. And the first CV that I gave was to Believers. And luckily, I didn't have to use the other 9 CVs that I had printed. So my director was a very open-minded person. He didn't know about family, but he took the he's my mentor, Dr. George Chandy. So he took the risk of having a clinical pharmacist, even though he didn't know what we are supposed to do. He said, okay, let's see what you can do. So that was the initial attitude in which he took me. And he was a very supportive person. And I was given over to my pharmacy in charge, who was a doctor. And he also told me, Grace, I have no idea what pharmacy is. I don't know what you're supposed to do. So why don't you tell us what you're supposed to do? Okay. Just imagine to a fresher this question is being asked, especially when family is very new. Nobody has heard about family. Now, at least so many years, people have been coming and going. Many hospitals, most of them would have heard about family. So I told him that, so you have to give me a department first. And in that department, I will go with rounds and all these things I'll do. And I will do my work, is what I told him initially. So he told me, you select your own department, whichever department you want to. And I selected general medicine because general medicine is the most exciting one because you have all the drugs, you have everything, all kinds of cases, all complicated cases. So I liked general medicine when I was an intern. So I told sir I would take general medicine. And I told him that in the morning, I'll go for general medicine rounds and everything. And in the afternoon, I will see the critical care patients, the ICU patients. So I chose those 2 departments. And as and when I was doing things, I always had this problem of not knowing sufficient to always had that insecurity within me that how do I progress from this? How do I make myself better? So that's when I thought, I need some kind of training. I need something that I need, to call myself as a good clinical pharmacist. I was doing well. It's not that I was not doing well. I had, the easiest thing for me was the drug dosing. It's the easiest thing you can do, dosing of meropenem and all these things in kidney injury. Then uh, finding out the medication errors, the reporting the adverse drug reactions, all these things were the initial part of what I've been doing. And especially the hospital was new, they were looking for the NABH accreditation. I helped them with the NABH accreditation also. So this is what I initially did. But I always felt that incomplete feeling within my training. So I was always curious about antibiotics. Curious in the sense, when I was doing my 5th year, that's when I got this insight into antibiotics, the spectrum, what antibiotics you use, and all that. So from that time onwards, I've been quite fascinated with antibiotics, and I thought ID is something that is I need to. Stewardship is something because NABH also has that stewardship part to it. So I thought I need to learn about stewardship. That's how the whole thing started. And the first thing I remember in 2017, I told my director, we had an idea, we had a conference, we had a continued, I'm sorry, this continuing medical education, CME on, there was a person who came from the US. His name was Dr. George Abraham. He's currently the president of the this amazing Physician Association, American Physician Association, AAP. Currently, he's the president of that. So he's basically an ID physician who is from Kerala. So he came here and he gave us a good, talk, and I was inspired by him. And he went back. So at that time, I went to my director and I asked him, "Sir, I would like to know how a clinical pharmacist how a clinical pharmacist works very well abroad because I can't have any superstars or people who are working in clinical pharmacy as role models in India because it's still new. So I would want to go and see how it's done outside because that's where it's well established. So and he told me, yeah, I can arrange for that. And that's how I first visited the US. And luckily, I shadowed an infectious diseases board certified ID person Her name was Kirtana Bulak, and she was in Tufts Medical Center. If you look up Tufts Medical Center, Boston, it's one of the best centers in US. So I had the privilege to just shadow with her, and it changed my perspective completely from all these medication errors, reporting, dosing, and everything. She was all in terms of pharmacokinetics, the first line, second line, all these things. It's very impressive that I saw what I saw there. So they have maybe 3 or 4 consults, ID, infectious diseases consults for patients, and in a round table, the physician will sit, the ID physician along with the fellows who are working up the case, and the clinical pharmacist, the ID clinical pharmacist, will be sitting around the table. And the clinical pharmacist will say, okay, I think this is a drug that you should prescribe for this person. And it's a very, like a very, how do I say it? It's a well established system where nobody is questioning anyone. The case is being presented, the clinical pharmacist automatically comes up with the solution. Okay, nobody's getting hurt, nobody's saying no, you can't say that, what is your opinion. No, it's a well set system that she will say what has to be given. And the ID doctor also would ask, what do you think, which one is linezolid or the other one. And it was just amazing. And the kinetics that she used, the way in which she used kinetics to back her up, it was just a perspective. The whole change of my perspective happened there, and I knew how an ID pharmacist can work. So then I came back. That's when, again in 2017, I came back and I went for my first ID conference. ID conference, that is the national ID conference by the ID doctors, which is called as a SITSCON. The next SITSCON is happening in Hyderabad in August. This next month, SITSCON is happening in August. Next month, it's happening in Hyderabad. So in 2017, the first one that I attended was in Nagpur, in Maharashtra, Nagpur. And again, so I came straight from the US. Within 2 or 3 days, I went for the SITSCON, and SITSCON completely changed me because the way the doctors were talking, it was like they were speaking some foreign language. I couldn't understand a thing that they were saying. It's all too high funda things that they were saying. That's when you get this feeling that you don't know anything. Okay. The only thing that you know is something about stewardship. If they talk about some stewardship or some like Acinetobacter or resistant bugs, that how do you treat it? Which drug do you treat? Colistin or meropenem, colistin plus meropenem. These were the things that you could make out from the talks that were giving out. But they were all brilliant presentation, brilliant talks, quality talks. And SITSCON really changed me in that manner because it made me realize that not just the pharmacokinetics that I saw from Kirtana, and I also had to learn the Indian perspective, all these other things the ID doctors are talking about if I want to specialize in infectious diseases. So with these two, with these two, I thought maybe time for me to find some certification, and that's when in 2018, during the 2018 SITSCON, no, sorry, 2019 SITSCON, I met Dr. Priscilla Ropali. She was the head of infectious diseases at CMC Vellore. And my director, Dr. George Shanti, he was a former director of CMC Vellore. So that was a connection I got. So I went and met her. I told her I would like to train with you. And I knew that she was going to roll out a fellowship course for ID. So I approached her, and she said the fellowship will start maybe the next year. And they are planning on doing a certification course. So that's when I told her, yes, I would like to do that certification course because I want to have a better chance for getting the fellowship. So being with you for 6 months also, it's fine. So I went to CMC Vellore. I was deputed from Believers to be at CMC Vellore. And 7 months, I did that certification course in antimicrobial stewardship for clinical pharmacists. So that was the first formal training that I received from one of the prime institutions in the country, because CMC is the institution where they started infectious diseases as a super specialty. They had the first DM program. So in every way, that is the best institution. To me also, it was easy because my director was there, former director. It was an easy thing for me to ask him also. So everything was just everything went so well that I completed my certification course. And I remember in 2000 2018. So this course, I did it from 2019, I think October to 2020 April. That's when the code and everything happened towards 2020 March, April, right? So I was there in PMC for 7 months. In 2018, I had somebody told me about this Society of Healthcare Epidemiology for America, the SHIA. SHIA, you have some ambassador program. In 2018, I applied to them, saying that I would like to come to. I would like to become an ambassador because I am very much interested in stewardship. And I sent my application, and they rejected me in 2018. And 2020, I completed my CMC training. And at that time, I started preparing for the board certification. So, with the help of what CMC has given me, and like I said, I say this in every conference that I go to. I went to CMC to study antimicrobial stewardship. Okay, all about bacteria, the AMR, which the high multi-drug resistant organisms and everything. I went there to learn about the stewardship. When I went for the grand rounds on the first day, the first case that I was introduced to was disseminated histoplasmosis. The second case I saw was disseminated toxoplasmosis. All these things which were entirely new to me because these are all fungal infections. These are all the opportunist infections. So then I knew that AMR stewardship is not the only thing for ID. You have to learn a lot about viruses and fungus also at that time. So with all that, the training that I received from CMC, I was started preparing for the board certification. In 2021, I wrote my certification exam in September. In November, the result came as I got the board certification. So these and during that time, I also took the SIDP. There is one acute care hospital antimicrobial stewardship certification course also. So these were the things that I had with me, which prepared me towards the exam. In the formal trainings that prepared me towards the exam, and I wrote the this certification. In 2021, like I said, got the certification. So I wrote to Shia again because that was the time when you could apply. In December was the last time, last month where you can apply for the Shia ambassador. So I told you 2018 they rejected me. In 2021, after getting the board certification, I wrote to them again, saying that I wish to become, this ambassador because I would like to learn more with global collaborations and things like that. And then I was selected as a Shia ambassador, which is if you uh, if you are in an ID circle, if you are in an infectious disease circle, the SITSCON that I told you, it's all about the doctors, the microbiologists, they all come for this high funda SITSCON. And for them, they know the importance of Shia, the Shia ambassador thing. The doctors want to be an ambassador. So that year in 2022, where I got selected as a Shia ambassador, usually they select 18 people from across the globe, like from Thailand, Malaysia, India, all across they'll take. But because it was post COVID 2021, 2022, they only had 6 ambassadors that year. And I was the first PharmD graduate who got the Shia ambassador, that tag. And 2 Indians were selected. One was an ID physician who was Dr. Rajalakshmi, and the other one was me. And I had other people from we were 2. Out of 6 people, one was from Argentina, one was from Bangladesh, one was from Nigeria, and one was from Malaysia. So it's like a huge honor that you get to be selected as a Shia ambassador. That really helped me. And what happened was that when I went for the Shia, again, anyway, you are getting sponsored to go there to the US. The flight ticket anyway will be taken care by them. All right. So I thought anyway, because you are going, putting so much effort, why not train something? Why not go as an observer somewhere else and learn? So because I'd gone to SITSCON, I know that Dr. P.H. Chandrasekhar is the father. I call him the father of infectious diseases in India. Okay, he is the one who was graduated from CMC Vellore as an MBBS person. He's a Sri Lankan actually. He's a Sri Lankan who graduated MBBS from CMC. He went to US. He studied there. He took his specialty in ID. He became an ID physician, and then he came back to India and he started training all the people who are interested with in ID in infectious diseases. He personally took them with him to the US, trained them, and put them back in India. So this is a person that everybody considers the father of ID. And luckily, again, he was my director's classmate. So again, with Sir's help, I wrote to him saying that I would like to come and be with you for 1 month. So I stayed with him for 1 month at the Wayne State University, Detroit, Michigan. And I can tell you, so people ask me, why do you take board certification? It's so costly and blah, blah, blah. All these things are there. Okay. So I'll tell you what happened. So, like I said, in 2017, when I went to Tufts Medical Center, what they were talking about was unthinkable. Unthinkable. For me, it is, I couldn't just imagine sitting at the position Kirtana was sitting and telling them, do this, do that, all these things. But when in 2022, I went to Detroit Medical Center, uh, I could tell them what to do. Because I went with the ID team, they had an ID clinical pharmacist. So whatever suggestion that he was coming up with, I could make the same suggestion. I could come up with that in my mind. And that's how I knew, okay, I've grown as a person in career with infectious diseases as my specialty, and board certification definitely helped me in that regard. So whatever I can assure you, whatever a person does, an ID person does in US, I have certain confidence, not arrogance, but certain confidence to say that I will be able to do that to some extent. Not in the pure extent because they're so much advanced, but whatever is within the Indian context, I'm sure I'll be able to come up with the same kind of opinions and consultations and things like that. So this is something the board has done for me. The certification has done for me. So that's how I knew, like, it really changed the career path of mine. I could be confident whenever I'm going and talking to a doctor. I was much more confident in telling them because I knew that what I'm saying was right, and I had literature to back me up. So this all happened because of the board certification. So SHIA happened in 2022, and again the same year, the Board of Pharmacy Specialties, which gives out the board certification, they approached me to be their ambassador for 2022 to 2024 till this year. So again, a big privilege for me. So these all things are new. I know these are all things are new to the Indian context. Nobody has taken it before. So these are all things that we can all explore. There are 100 other things that, such things that I have not explored, which others can explore. It's only you just have to write to them and tell them. You'll have to convince them that you are capable of what you are offering them. And I'm telling you, it will change your career.
Definitely, I would love to hear this, ma'am. As you mentioned about the ID Congress 2024, it is going to be held in Hyderabad. And to
No,
be
no, no,
informed,
no, no, no. ID Congress and SITSCON are entirely different. Okay. The ID Congress. Okay. Anyway, you complete your question. I'll come to that. Yeah.
okay, ma'am. Actually, I when I saw your Instagram, LinkedIn ID, then I got to know that ID Congress was such a fabulous conference, ma'am. When I was going through that, then I was thinking that when it is going to be held at any places, I am going to attend at any cost. So I thought that I'm in Hyderabad and I will not miss this opportunity.
Yeah. Thank you. Thank you for saying that because uh, I'll tell you the idea behind ID Congress. The conference that I went
Ma'am,
is not
we are having some particular questions regarding that. We will wait for that.
okay. Which regarding ID Congress.
Yes, ma'am. Yes, ma'am.
All right. Okay. So do you have a question for me now or?
Yes, ma'am. Yes, ma'am. We are having. Yes, ma'am. We are having lots of questions, ma'am.
Yeah, please shoot. And tell
So,
me when,
ma'am.
when I'm going beyond my time also, okay? Because
Okay, ma'am. Okay, okay. What are the some of the biggest challenges you face in your practice today, ma'am? How do you overcome with them?
practice, the biggest challenge that
Into the hospital, ma'am.
uh, personally, if you'd ask me, I would like to do more research than what I'm doing right now, and that is one avenue that have not gone into much, and definitely that is I know that is my way ahead. Research is one thing that I've not touched that much into, and definitely something that I'm very interested to do and do further, like a PhD or thing like that is something that is next in front of me. But if you ask me what are the challenges that I face, earlier before the board certification, I can tell you. Like I said, I was always doubtful. See, I would because I would want to connect with the people who are listening to me, because I'm sure you all would have gone through the same thing. So it's easy for you to connect with me when I say that before the board certification, I was always doubtful if I go and say this to a doctor, am I right? Is it correct? If they ask something back to me, if they ask some other questions back to me, will I be able to answer? Was the major problem that I had. So that's why I told you the series of things, trainings that I undertook to make sure that I'm confident in what I am. Um, so before that, that problem was there. Now I do not have the problem of communicating to the doctors in the sense that if I know that something is wrong, some practice is wrong, I can definitely go and talk to a doctor and I tell them, so this is the problem, and I'll send them the literature behind it. Okay, what is one example that I can give you is that when you have a necrotizing fasciitis, kind of an infection on the foot, on the foot, the patient is admitted. You've always seen something like clindamycin that is being added to necrotizing fasciitis. And the reason why they add clindamycin, even if the bug is resistant to clinda, is because clindamycin is supposed to be helpful in, the necrotizing fasciitis is a very rapidly progressing disease. It worsens in such a short time. Okay, it's not something that goes on for a certain time. It kills a patient if you don't treat it well. So, because of the rapid progressing nature of the disease, the reason why it is so rapid is because a lot of toxins are being produced by the organisms, like the gram-positive, especially the gram-positive organism, like Staph aureus or Streptococcus. Both these Staph and Strep will produce a lot of toxins. So clindamycin is actually being added to the therapy so that the toxin production is halted, or it is pulled back. Because you know that clindamycin is a protein synthesis inhibitor. So because it is a protein synthesis inhibitor, if you give a protein synthesis inhibitor, the amount of toxins that are produced would be on the lower side. This is the rationale behind giving clindamycin. Okay. So if I see that, let's say the patient has come up with an MRSA, methicillin-resistant Staph aureus necrotizing fasciitis, they are giving clindamycin, and then the next day, when the culture has come, and the doctor is giving clindamycin plus meropenem plus linezolid. Okay, this is something that happened recently. So these three things. Okay, because it is necrotizing fasciitis, especially in an Indian scenario, you can't always say that whatever the guideline is saying is purely applicable to the Indian setting also, because we don't have Indian guidelines. So in such cases, I know that we are at a higher risk of having a gram-negative infection. So with meropenem, I'm okay. I mean, because it's a life-threatening infection, maybe for some more days you can continue meropenem. That's fine till the patient is recovering. But when you add linezolid to clindamycin, I have a problem, because the doctor doesn't know that linezolid will also inhibit the toxin, not just clindamycin. So if you have linezolid, you don't need to give clindamycin. You can stop clindamycin. You can continue linezolid because it's an MRSA, it's a sensitive one. Why not give linezolid? But you can't give both. So in such cases, I will talk to the doctor. I will send them all these literature that are there, the guidelines that are there saying that linezolid can be used as an agent for toxin suppression, either with staph or strep. So, like that, see, these are all difficult conversations. I'm not saying these are easy conversation, but because now that I know that these are the reason for treating an infection in such a way, and linezolid also is a protein synthesis inhibitor. So you're giving a protein synthesis inhibitor and you're treating it. So then I can confidently go and talk to the doctor and say that, sir, please stop this. Please stop clindamycin. Linezolid will take care of your necrotizing fasciitis, your toxin. So this
Okay,
is
ma'am. Sorry to interrupt you, ma'am. We are lacking with time, ma'am.
all right. Okay.
So, ma'am, we will move with the next question.
Yeah.
So, ma'am, what are the some advices would you give to the students and young professional aspiring to the enter into the field of pharmacy? Which upcoming generations, ma'am?
The one, I think the bigger advice regarding, if you think that I have inspired you in any way, with regard to what I have achieved, it's not been achieved in a short time. Okay, it's whatever I am right now. It has been a years of continuous education and preparing myself towards all these things. So it won't happen in in a year's time or things like that. So I made sure that every year something kept on happening, something kept on either some kind of course. Like I said, 2017 went to the US. 2018 was when I attended the next conference. It's called 2019 is when I joined for CMC. 2020 was COVID and it went off. 2021 I got my board certification. 2022 was SHIA. Again 2022 was BPS. 2023 was the first ID Congress. Okay, so making sure that you progress throughout your career and you're not just sitting there is a major thing if you want to advance in your career. That is number one. The second one is with regard to how you study. I've already shared, when you have a disease, from starting from anatomy to the guidelines, that is something that will definitely help you. And the third thing, again, something I tell all the family freshers, like I said, if you've listened to my story, you know that I could do all this because I had a supportive leader. I had my director. Okay, he's a powerful person with whom I could go easily and talk to, and tell him these are the problems that I face. So that support is something that you need. If I was not in this institution, I always think, where would I be? I would not have been the successful. This is my feeling. Okay, so having somebody very supportive in your career is very important. So the reason why I'm saying this is that people always come and say, "What is your whenever you're going to join a job, what is your salary?" Okay, you have two institutions where one is offering you 20,000, the other is offering you 22,000 as a starting salary. You automatically want to choose the 22,000. Okay, because the salary is higher. But look at the institution as a whole, whether it's an academic kind of institution or is it a small setup, whether there's a doctor that you would aspire to work with, whether you have sufficient support, all these things also should come. Because money will come when you have the skills. And when you're a fresher, you have to have your skills. So when you're a fresher, make sure you have the opportunity to create new skills. Then money will automatically follow you. So this is a career advice I would give every fresher. Don't look for the salary. Look, if you are able to build yourself in your career, that is one thing that I would definitely ask everyone to be careful
I
of.
think you have cleared many of our doubts, ma'am, with the career opportunities. So, ma'am, we will move with the next question. That we see you have a very good involvement in the anti-material stewardship, specifically internationally. So, how do you get those opportunity, and what make you step over that?
So it's all about, I wanted to learn. Whenever I feel that I'm not doing well, that drives me from within. I have, because I can't stay like this for some time. Like I said, I know that research is something that I have not touched into, and it is making me uncomfortable. I do not want to be in my comfort zone, just earning my salary and just being there. I have to progress. So whenever I feel that I don't know certain thing, that's what happened with stewardship. I didn't know stewardship. I wanted to learn about stewardship. So that should drive you. What next? What next? So the one other thing that I usually tell my colleagues is that, how do you see yourself in the next 5 years? Okay, the same people that worked with you as junior doctors. Okay, when you are in a team, there are junior doctors, there are pharmacies, right? The person after MBBS is there. After 5 years, he'll do his MD and he'll be a consultant. What will you be? Will you be the same clinical pharmacist? That should drive you. If you are working in a hospital or something, think of that. What will I be when I'm 5 years? After 5 years, where I will be? So that kind of drove me also. And now I can confidently say that I'm not at all worried about that anymore, because I've already established myself in my position. Now, the hospital that I'm an assistant director of the hospital. So it has put me on that administrative this thing already. So all these things should drive you, that whatever insecurities you have, go and confront it and make sure you achieve the next level.
Definitely, ma'am. Definitely. We will stick toward that also, ma'am. So, ma'am, you attended lots of conferences, ma'am. Can you share which was your best conference ever and why?
Okay. So like I said, because I was interested in ID, the conference that I attended that changed my career again. Again, a tipping point in my career was going and attending the CITSCon. CITSCon is the Clinical Infectious Disease Society conference. Okay, so CITS is a society, Clinical Infectious Disease Society of India. Like that, you have for critical care, you have ISCCM, the Indian Society of Critical Care Medicine. All right. So similarly, every specialty, whether it's cardiology, oncology, they have a national get together of the doctors where yearly a national conference will happen. Gastroenterology will have one, your nephrology will have one. It is going to be a high funda thing, but go and attend it. Then you'll understand how much you lack if you want to be in that specialty. That's what happened to me at SITSCon. So SITSCon is where I saw that, like, people sticking to time. What I was used to was that having a seminar where a speaker will go on speak for one hour, 2 hours about one topic. SITSCon is the first time I'm seeing that senior doctors, the ones with the gray hair, coming there, 20 minutes they are given for their talk. If you finish in 20 minutes, well and good. If you don't finish in 20 minutes, go out. You can't finish. Okay, they are very strict about the time. So, how a high quality conference was conducted is something that I saw in SITSCon. And this is something that I wanted to introduce for our clinical pharmacy community also. So, like I said, when I went to the US in 2022, I met a lot of people during the SHIA conference and I met Dr. P.H. Chandrasekhar. So these were the people that I invited for the ID Congress because I wanted to create something very similar like SITSCon for the clinical pharmacy fraternity, like high quality topics. You don't go and speak about things that doesn't matter, not an inspirational talk. You stick to the subject. You stick to the whatever you want to take. You take in within 20 minutes or 25 minutes. That's it, and you finish and come off. So this is what we created for ID Congress. That was 2023. The one that you're talking about is 2025 ID Congress that is going to come in Hyderabad the next year. Okay, something that I would definitely, because that's how a conference should be. The clinical pharmacists need to know that.
Definitely, ma'am. So it was quite interesting to hear about that conference. Recently, what I was talking about the ID Congress, and now the question is here only. Believers Church Medical College hosted an international conference, ID Congress 2023, whose theme was making antimicrobial stewardship a top priority. So, how do you see this theme in the next couple of years, and can you share your experience of ID Congress?
Yes. So now you know the evolution of ID Congress,
Yes, ma'am.
the reason why ID Congress came into being. And
The main part about that, what was the theme over that?
I didn't get you, sorry.
Ma'am, the theme of ID Congress 203 was making
Yes.
antimicrobial stewardship a top priority, ma'am.
So if you look at the Center for Disease Control, CDC, who comes up with all kinds of guidelines, no, CDC comes up with your H1N1, your COVID, every guideline. According to CDC, for an antimicrobial stewardship, if it has to be successful, there has to be 7 elements towards it. Okay, that is including, you need a leader, you need to commit. There should be um, leadership. Then comes, oh my God, I can't believe I'm forgetting this one. Leadership. Then there should be accountability. A person has to be accountable for a stewardship program. Then the third one is drug expertise. That means there has to be a pharmacy expert, a clinical pharmacist or a pharmacist who is an expert in infectious diseases to co-lead the program. So this is the CDC guidelines I'm talking about. So CDC has placed pharmacists way ahead, in when it comes to antimicrobial stewardship. So this is something that we wanted to convey everyone, that clinical pharmacists should be there in an antimicrobial stewardship program. So in ID Congress, what we had was that 50% of the speakers were ID physicians and 50% of the speakers were clinical pharmacists. Again, the first in the country to have this kind of a mix and match. So you're telling them we have equal importance to run an antimicrobial stewardship program. So this is why I felt, and we have a lot to do when it comes to stewardship. Okay, more than I would say 70% of the work when it comes to stewardship is being done by clinical pharmacists. So this is something that I wanted the world to know, the clinicians to know, the students to know that you have such a big role to play. So that's why we meant the theme making antimicrobial stewardship a priority for ID Congress 2023.
I think it's going to be revolutionary, ma'am.
Thank you. I hope so. I hope so. Every year,
Even me too, ma'am.
theme also is getting changed. Last year it was critical care. Next year we are
Okay.
discussing regarding the theme also.
Okay, ma'am. So, ma'am, it's my biggest question that as we got to know that you are a BPS ambassador. So, can you share us how to get the BPS certification and how are these certification valuable?
Yes. So I think I've already touched upon that and how it has impacted me personally. Like the only thing I have to, I can I need to tell you is that my 2017, the first time when I went to Tufts Medical Tufts Medical Center versus 2022 when I went to Detroit Medical Center, the change it had brought to me in my career, to a person who knew nothing, to a person who is as as erudite as a person uh, in the US. So this is what BCPS has done for me. So board certification requires a lot of patience, requires a lot of reading, a lot of dedication, and for basically there are certain ways in which you can attain your board certification if you are in the US. Like we don't have postgraduate programs after PharmD. Like we have PharmD, that's it. We don't have any more courses than PharmD. But in the US, they have PGY1, Y2, that is postgraduate year one, postgraduate year two. Postgraduate year is like general medicine kind of thing, where pharmacotherapy. And PGY2 is where you specialize, whether it is transplant, oncology, cardiology, infectious diseases. So anyone who has done PGY2 can directly take the exam, okay, in the US. If you have completed your residency, the PGY1, Y2, you can take infectious diseases. Because we do not have the residency program, the only way you can take the exam from India is you have to have 4 years of experience. And I'm sure Dr. Anita would have talked to you regarding the pharmacotherapy, right? So Anita is also just my junior in PSG. So I know how brilliant she is. So she has cleared the pharmacotherapy exam. So for pharmacotherapy, it is 3 years of your experience. At least 50% of your time you spend in, the pharmaceutical care is what for pharmacotherapy you need. When it comes to specialization, 4 years is you need. So if you want to specialize in cardiology, you need 4 years of experience in cardiology before you can take the exam. And from the Federation of Clinical Pharmacists in India, FCPI, we have done a full webinar on the process, the fees, and everything with regard to how board certification is done with Brian, who is the executive director of the Board of Pharmacy Specialties. So, because a lot of people have a lot of doubt regarding board certification, we have covered everything in that video, in that panel discussion, and it is available on YouTube. You can go to the FCPI page and you can just see the board certification webinar, panel discussion. Everything is cleared there. If you have more doubts, please revert to me. I can clear anything that I can.
I hope the audience has grabbed that opportunity. So, ma'am, not last but not the least, how do you see the field of pharmacy evolving in the next decade, and what role do you hope to play in this evolution?
Uh, I think we should strive towards excellence in clinical pharmacy because we are still in a stage where what is being taught in the college is not adequate when it comes to your clinical practice. Like I said, the vertical integration of the curriculum and what is happening at the bedside is not happening. So I am hoping that in the next 10 years, that's something that we are very much looking forward to, that along with the Pharmacy Council of India, we will be able to move some kind of changes in the curriculum so that whatever we are learning, it is being applicable in our clinical setup also. And I think after that, I'm sure a lot of people will be taking board certification for sure. And I'm very excited to share with you that one of my colleagues, his name is Dr. Vineet Jayakumar. He has written the board certification this year, and he got his board certification. This is his first attempt for BCPS, pharmacotherapy. And he is my colleague. He's working in Believers. So again, an inspiration for others who wish to do the board certification. So I'm hoping that a lot of board certified people will come, because I know how it changed me, how it changed my practice. So if such people come forward, then we can train the people who are coming with us, no, in that regard, with high quality, what you need to learn with the board certified people. And I hope that universities will slowly, like this is how it's done in the US. Like universities, they will have people from the hospital teaching the students. Okay, it's not just people who are sitting in a department just teaching subjects over and over again. It's the people who are the preceptors are actually practitioners, clinical practitioners in clinical pharmacy, who are taking students these classes, which will really help them in achieve that higher level of education. And definitely, I know that clinical pharmacy is coming in a big way. Um, the problem with us is that, like I said, I don't mind being explicit. After our PharmD graduate, I mean, after our graduation or our degree, when we get our degree, we are not so useful when it comes to implementing things in the clinical setup. But if that can change, PharmDs will have no limit. Okay, I can. One other thing I can tell you is that if you have a supporting institution like I have in Believers, you will not believe that currently there are 65 clinical pharmacists working in Believers. It's a huge number. 65 people being, in a medical college setup, having 65 people is a huge thing. So there are so many things that we can do if we get the opportunity. And also, again, research is something that is blowing up. Therapeutic drug monitoring is something, is TDM is something is blowing up. So all these things, I hope in the next 10 years of time that so many of inspirational figures will be there for the students to look up to, and do wonderful jobs, and show them that clinical pharmacists are very worth and useful set of hands when it comes to healthcare or research or even in industry. So I really look forward to that, and I'm excited also.
It's very quite tough to say that it is my last question. What is your future goal in the field of pharmacy education and research, ma'am?
Yes. So with regard to research, I am, I don't know, this is again my dream, my goal is to become again super specialization. Like I have taken ID now, and I want to look in towards therapeutic drug monitoring. TDM is something that is slowly coming up. So TDM is something that I'm interested in. And if I get an opportunity, I would really want to explore that with research also. And see, I told you I'm a person who can't sit just like this. I have to get to the next stage. It has to drive you. So I'm hoping that also with the help of FCPI, also we feel that we'll be able to teach a lot of students the clinical practice things that are there, because it's all about working pharmacists, working clinical pharmacists, doing. So I think that's how we are heading towards clinical pharmacy excellence. And with research specifically, I have something like TDM in mind, or something related to infectious diseases for sure, is what I have in mind.
So very good to hear, ma'am. Now the audience, the platform is only. So you can unmute yourself, or you can open your camera and interact. Or if you don't want to open the chat box.
I have a question here from Anjan Kumar. Any courses to learn in infectious diseases from CDC or any other good source? So I would suggest two things that I have done before. One is the WHO. There is an open course for antimicrobial stewardship, I think. It's an open, You just look for WHO MOOC, MOOC, Massive Open Online Course on Antimicrobial Stewardship. There is one very good, preliminary course that I feel every student should take it. So every student, whoever is listening to me, that WHO MOOC is free. So that is something that they can. And there are certain courses on Coursera also. Sorry, not Coursera, FutureLearn. FutureLearn also has a lot of online free courses regarding to stewardship and related ID related things. So I would definitely would like you all to go and explore such things, which are free. First, do what are free. Then, if you're still interested, go for something that is on a payment based thing. All right. Um, all right. Is there anything? Okay. If you have any questions, please let me know. A link of
Yes,
speaking.
Swati, please go ahead.
Hi, ma'am. How are you? I'm Swati.
Hi, Swati. How are you?
I'm doing good, ma'am. I was really super excited to meet out again and to listen your story again. It was like a great inspirational story, ma'am. Really.
Thank you, Swati. Thank you so much for having me here. Also, it's always a pleasure for me to talk to the students. So yeah, thank you so much.
So like when I was like when I thought formed as a DBABIs, I have done my internship over BCMCH and I have met super people who had made me experience the PharmD roles and responsibilities besides textbook. So I was like, yeah, PharmD, we can do hospital works also, and we can do only our work rather than discriminating our works against. So this was the main thing I have learned, and I implemented these changes in my internships too, ma'am. Now besides research, I'm also focusing on clinicals also, ma'am. And
Yeah.
thank you so much for the experience.
All right. Thank you so much, Swati. If you all don't know Swati, we call her the rock star of research because she has published already some, how many, Swati? 36.
18 published, ma'am. 36 is under review, ma'am.
Okay, all right. Okay. So anyway, she has taken the time to write up 36 papers in her name while being in the fifth year, right? Right now you're in the fifth year.
Yeah, ma'am.
Yeah, in her fifth year, she has 36 publication, not publication as such, at least under review. Swati, I don't even, I have 10, okay, maximum 10. After 8 years of experience, I have only 10 papers. So we call her the rock star of research. And we were so privileged to have a person like that coming there and, inspiring our interns also to do so well because you stand out. This is how you get people's attention, get people to hire you when you stand out. So thank you, Swati. Thank you for being with us in Believers also.
It's really my pleasure, ma'am, and it
Someone
changed my
else?
point of view of PharmD as well.
Thank you. Thank you so much, Swati. Yeah, I'm looking at the chat also. If there's any question, I can take it on the chat also. I didn't understand the question. Anything with internal medicine for PharmD? Do you mean the board certification? If you are meaning board certification in internal medicine, it is same as kind of pharmacotherapy, the BCPS. Okay. I have raise of hand, Harvinder Kaur
Hello,
Walia.
ma'am.
Yes,
Paul.
yes.
Ah, yes, good evening, ma'am. So,
Good evening.
I wanted to ask, you are in the clinical side of pharmacy and everything. I wanted to ask you your experience and your viewpoints on how AI and technology is doing there, and what you expect to, happen in the future when it comes to advancements in both fields in the next 5 to 10 years.
Yeah, so definitely we are moving towards the AI era. There is no stopping of it. There is no thinking of it. And even though the senior people will say that AI is not going to do anything, I'm sure that AI is going to solve a lot of problems for us. See, the major problem that we are feeling with AI is that whether they will replace our job and all these things. Not just clinical pharmacists in general, for everywhere, whether it is a computer person, whether it's a medical person, that is a problem that everybody is facing. I mean, in the sense, the fear they are facing. So AI, in my mind, let's say if you have a good AI, let's say you have a patient on meropenem, and if you can integrate your artificial intelligence kind of thing into the system, if they can come and if it can be integrated, and if there is a creatinine clearance of this much, or creatinine is this for this patient, you know the weight and age of all these patients, because these are all in the system. So if AI is there, if they can come up with the dosing automatically, and let's say when you're entering your notes on the on the system, and let's say um, a patient was given a certain drug. The next day, the patient had some kind of hemolysis or something like that. So, if you have an integrated system where the medical software and things are there, if they could pick up, if AI could pick up the adverse drug reaction kind of thing, it will ease a lot of things that are usually missed. And this is with regard to clinical pharmacy I'm talking about. Dosing and everything makes so much easier. And also with I mean, every aspect. Like I use AI, for like I think you generation, the young generation who are much younger to me, also you definitely will be using AI for all your different things, right? For your slides or your, documents, the mails, and everything. So in that way, you know how much it is useful. So similarly, I'm hoping that AI would change all these things. At least the physical things it can't change, but at least all these technical things, if it could give directions. If like I said, if a patient with MI is there and if they miss beta blocker, if AI could come up and say that you've missed this thing, do you want to add? Would definitely be one of the major things that can help us in being, adherent to the guidelines. So such things, I'm hoping that it would come because anyway, AI is going to come in a big way. I'm hoping that it would change healthcare in a good way, in a good sense.
Okay, ma'am. Because from what I read about this recent news where there's this hospital in China where they used robots to actually perform a few surgeries. What surgeries would have taken the doctors 3 days to perform, those robots performed it in 1 day itself,
Yeah,
and it was done with quite a lot of precision. So
yeah,
from what I have read is basically matlab, robotics specifically, when you integrate it with AI, it is capable of doing a lot of physical work, whereas when it comes to decision making, it is not that precise at the moment, and it cannot give you the correct answers that you require. It does not have that, but it says, but from what I have
yeah.
researched, they say that.
AI is a very, it changes so fast, right? It is basically a collective. AI is all about having the collective experiences together and getting the best out of for certain scenarios. If that collective experience is there, based on what data has been already been there in the, in the internet or wherever that you're talking about, like you're saying, the surgeries also, AI is an adaptable thing. It always adapts to the better one, and they are very
Hmm,
precise,
hmm,
right?
hmm.
So I feel that even in decision making, also it will change a lot. It might not be precise right now, but in the coming years, definitely, because it's all about, see, how do they format mails? Because there are millions and trillions of mails that are already there in the internet and things like that, that they have access to, right? So
Exactly.
similarly, such decision makings, in formatting certain things, guidelines, and everything, AI would be useful in the coming years because it's so adaptable.
Okay, ma'am. Thank you.
Uh, okay, how to get into Believers Church Medical College Hospital as a clinical pharmacist? Okay, that's a very good question. Uh, oh my God, how do I answer this? So, one thing that I would ask you to do is first do an internship, because you have 3 months of internship that you can do it outside your hospital, right? So, if you look at what is happening in Believers, it's mostly the interns that we know that are doing well. We give them a preference when there is a vacancy, because they've already proved how they work, their quality of work, with those 3 months. So 3 months are we have Nazareth College of Pharmacy. We are the institution with a clinical arm. So anyone who wants that means 1 year, full year they are here, and they don't. So 1 year they are here. So we see these children for this many time, and we know how good they are. So um, we we trust that. So anybody who wants to get in, if you can prove yourself in that period, in that internship period, you have a better chance of being a clinical pharmacist at Believers. So I think that is the easiest way I can answer your question. um, would you would like to know your point of view of PhD abroad and after family? All right. PhD abroad in family. Definitely something that I also am interested in. See, it's all about, if you had asked me this question maybe 9 years back when I was a fresher, my answer would have been very different, because that is something I wanted to do something. Therefore, PhD is an option. Therefore, I wanted to do something. But now, if you ask me, if you ask me, I want to do something in infectious diseases because I've specialized in it. And definitely something that I feel that I can contribute to. So taking PhD abroad I feel is a superb thing to do, and because I personally like it, and nothing should stop you if you have the will and the passion to do it. So I think that should be it. Okay, can you explain the renewal process of board certification? Yeah, so once you're board certified for 7 years. Okay, so after 7 years, there are two ways of renewing your board certification. That is either by getting the credit points, like you have, if you attend the CME, you have this many credit points, right? Similarly, board certification credit points are available with different organizations. Like, for example, for ID, SIDP, which is the Society of Infectious Disease Pharmacists. So SIDP comes up with webinars or classes that will award these 1 hour point, 1 point each. So if you have 100 such credit points, board which is accredited by the board, you can't go and sit in a CME and you can't convert that into board certification credit point. It has to be accredited board certification credit points. If you have that credit points 100, then it will automatically be renewed after 7 years. But if you don't have that, if you don't want to sit through this 100 webinars or things like that, you can retake the exam, which nobody usually prefers, because it's again a humongous thing for you to sit and study through the whole thing. And so definitely something that I would do is making, so it's basically updating yourself, because after 7 years the guidelines will change, all these changes in your this thing will happen. So this is their way of making sure that you are up to date when you call yourself a board certified person. So this is how you do it. Okay, then what are the prerequisite skills? Joining as internship in other hospitals. I am not sure whether there are any prerequisite skills anywhere. See, it's all about you are in one situation, you see only in a certain point of view, right? When you do it in some other hospital, you get a different perspective. So this is what that 3 months are for. Okay, if you choose to do it in that 12 months in that one institution, you only have that view. Okay, but if you go to a different institution, that's what happened with me. Each time when I go abroad, I see a new thing. I see a certain new perspective or better way of doing things. Then you go behind it. So I don't think there are prerequisites. Some hospitals, they have exams and all that, but I don't think as an intern, uh, at least you have to make sure that you are passionate enough to study and do that. All right. Can you please give insights about ID fellowships in India? All right. So is that fellowship experience counted in BPS certification? I think so. The fellowship certification experience can be counted. See, the only thing that you need as an experience is a letter from your employer saying that they have spent this much time in ID, in the 50% of this much time, at least in ID, from this time to this time. So if you can get that letter, doesn't matter whether it's a fellowship course or if you're working, it should be fine. All right. Insights about infectious disease fellowships in India. So I know about two fellowships right? I know about 2 fellowships. Okay. The first fellowship I've talked to you about is Christian Medical College, CMC Vellore has that fellowship in antimicrobial stewardship for clinical pharmacists. Okay. Which is a brilliant thing. And I can assure you, because I've been myself there, the caseload that CMC has, I don't think any other institution will have. They have 3,000 IP inpatients. Okay. So, and ID alone has some 40, 50 patients admitted in a day. So you get to see a lot of cases, and with these cases, you learn new things. So CMC1 is definitely my preferred choice. And then the second one that I know that has come up is the Indian Pharmaceutical Association has come up with a fellowship course in ID, because I am also a core member in that planning committee, in the core committee of putting together that fellowship program. So it is done in 10 different sites under the guidance of an ID physician. Again, which if done well, it's a very good course. If you, because all you need is that guidance to learn about what do you learn, how do you learn. So these are the 2 fellowship courses that I know which are good. CMC always definitely number one. The other one also, because it is IPA, there is credibility towards that one also, and you are given to a specific doctor to be trained. Where do you find guidelines for treatment protocols? Like I said, if you want to learn about, let's say, okay, in ID, meningitis, you want to learn about meningitis, just type meningitis clinical practice guidelines. If it is cirrhosis, liver cirrhosis clinical practice guidelines, yes, then you will get the top, followed things across the world, the guidelines that are being used. And you just ask your doctor which guideline they use, whether it is AHA or European, because always there is American and the European one. So whichever your doctor is following, go through that and get that knowledge. All you need to type is clinical practice guidelines. Okay, can you once again mention free certificate course? So WHO MOOC, that is the World Health Organization, massive open online course on antimicrobial stewardship is there. Then FutureLearn is a platform like Coursera that what is the other thing called? I forgot. Yeah, anyway, FutureLearn is something that has a lot of ID related course that I have taken. So that one is there. Any fellowship for PharmD to specialized diabetes management? I'm not sure. But I know that, again, CMC has a diabetic educator course, but that is usually being taken by the nursing. But like I said, when I was in internal medicine, general medicine, during the first initial bit, when I was in Believers in 2016, my consultant came and told me that if I'm interested, I should go for this diabetic educator course, and I was ready to go for that course. Okay, luckily, in the sense, because I had ID in mind, I went that way. But that is something that even PharmDs can also do, the diabetic educator course in CMC. But I don't know whether there are any other courses similar to that. But I think you can browse and see. Ma'am, which book do you prefer studying when you were in 5th PharmD? Yes. Okay, Dipper or Harrison. I like Kodak Kimball. I don't know why, but I really like Kodak Kimball, the approach, because everything was case based. I loved reading Kodak Kimball. Dipper is good, but my personal favorite is Kodak Kimball. Harrison is too big a thing for us to learn right now. But if you want to learn about the medical practice, Davidson is much more simpler, much more easier. Harrison is what the internal medicine MDs are learning. So I mean, if you have the time, if you have the energy, I wouldn't block you from doing that. But Davidson is something that is easier, that you can easily learn the aspects. So Davidson for medical part of it, if you want to learn. And then for clinical pharmacy part of it, Kodak Kimball is my personal choice. All right. So is there anything else? I think I've covered all the questions. If anybody wants to ask me anything specifically, don't hold back. Nobody is going to judge you. Just shoot your questions, whatever you want to ask me. All right. So I think everybody has asked their questions.
Any more questions? Yes, ma'am. I see one more question. Infectious disease fellowship are better or PhD in infectious disease is better?
Okay, let me tell you, Anjan, who had asked this question, it is very difficult for you to find a PhD in infectious diseases. I myself am struggling to find a PhD in infectious diseases. So I don't know what you're talking about, whether it is in terms of being in India or abroad. I'm talking about abroad. Abroad PhD in infectious diseases are usually quite difficult to get in. Maybe you can ask to certain colleges and see if they offer. If you get PhD, well and good. But it's better that you understand the whole infectious diseases as a whole, and in the sense you have a holistic approach, and then you focus on the area that you're interested in. Like I said, I am interested in gram negative resistance, all these things that you see in the ICU, because that is on a daily basis, this is what we practice. So I like gram negative resistance, so that's why I want to go to tedium, so that in gram negative resistance, how do you dose meropenem and how do you dose colistin, all these things kind of interest me. So that's why I'm more specifically looking forward that. So if you have that idea, it's better. But uh, in a way it doesn't matter, because once you take a PhD, you'll have your own your own path, then you can work it from there also. So it all depends on whether you want to go crucially into one area, or you are broad minded that you want to take anything and then go ahead with that. That is up to you. So yeah, it is 8:30 now. If you have any questions, I can take, or if you want to close also, that's fine. Yeah. Thank you.
I think there's nothing but thanks now to give, ma'am. They've asked all their questions.
I just want to talk to you regarding the FCPI. A lot of free lessons from FCPI. It's not an advertising that I'm doing for FCPI, but this is what I felt that somebody has taught me when I was a student. So these are the classes that we are taking for students. So whoever is interested in learning about, because we have started ID and critical care. If these two, if you're interested, you can have a look at the video and see for yourself whether it is something that you would like. I'm not trying to advertise for FCPA, just that something that I wished I had during my studentship.
Emergency medicine and critical care upgrading course for PharmD.
Critical care, I have personally taken. This is the ISCCM course. This is Indian Society of Critical Care Medicine. They have IDCCM. Sorry, IDCCC, Infectious Disease Critical Care Certification Course Certification, something like that. It might cost you earlier. I'm talking about 5-6 years back. It was some 4,000 rupees for enrolling for that course. I don't know whether they have changed it, but something very useful where you get to learn the critical care aspects of infectious diseases. When a patient gets admitted with meningitis and all those things. So that is something that I've taken before, and it was very, very helpful for me. So yeah, emergency medicine is something that is evolving. I also would love to learn about emergency medicine. Hopefully, when I get to know, I can post it in LinkedIn or so. If I get to know, I will definitely.
I'm sure, ma'am, from today's lecture, I feel like you will achieve whatever you want to. And wish you the best for that. And I don't see any other questions. So sorry, ma'am. I think Atif had some network issues, so
No problem.
he couldn't be here to thank you personally. Although I would have loved that. Ma'am, thank you so much for this very informative session. I'm sure all our students got to learn a lot from you and your experience. Thank you so much for joining us today, ma'am.
Thank you. Thank you. I wish everybody would achieve your dreams. Just you have to be a little bit consistent, persistent at your efforts, and I'm sure you will achieve it with the desire that you have in your heart, the passion that you have in your heart. I hope that God will help you all to achieve whatever you want to become, so that you will be proud yourself, okay, yes, I've achieved this, I can show the way to others. So that is a great feeling that you can get. I hope everybody will have a taste of that. So thank you once again for having me for this chat. It's always a pleasure to talk to students, and always happy to guide students in whichever way I can. All right. Thank you then.
Thank you. Thank you so much, ma'am.
Bye. Good night.
Bye. Good night. Good night, everyone.